I want to welcome Hudson Mghanga of Holonic, just to give us a quick round of some of the GYN solutions they have in relation to AUB, and then with that we can move on to the next thing. Hudson.
Distinguished guests, doctors, people who hold high position in the society and give us a daily assurance of continuity of life. I'm so excited to be with you here today and to give you a presentation and to talk about Hologic. I hope you will walk this journey with me as I present to you about our products. My name is Hudson Mghanga. I'm from the Kenyan coast, from a very small Taita community of about 300,000 people. So it's such a great privilege to stand here with you and see how we can create the impact in the society. I want to start by talking about Hologic. So we are an innovative company in the medical and technology, and our primary focus is on well-being of individuals in the society through detection, diagnosis, and treatment. So Hologic was founded in 1985, and as of today, it's 40 years old in the market. And that shows sustainability, consistency, and innovation as a company. Our chairman and our president and our CEO is Stephen Macmillan. He has been with the company for 12 years, but he has been in the medical fields for over 30 years. That shows how reliable we are as a company. Our fiscal revenue, year-on-year revenue, as of 2022 stands at 4.86 billion, slightly $5 billion. We are listed in the NASDAQ, in the New York Stock Exchange, and we have an estimated number of employees worldwide, 7,000 people. I am privileged to be among the 7,000 people working for this wonderful company. We are supporting over 4 billion people worldwide, and I'm happy to see the interest of having this company and our products in Kenya, with an estimated number of lives that we've impacted worldwide of about 3 million people. We have our headquarters in Marlborough, that name is very difficult, in the US, and we have 36 plus global research and market presence worldwide. So why Hologic? We've got 3 different divisions, and that's why we say we provide end-to-end solution. We are in the diagnostic, in the molecular space. We're in the thin prep for cancer screening. We also have proven solutions for breast and cancer imaging. Hologic, as of today, is the world leader for mammography, with over 80% market share in the US, 75% market share in Europe, and in Africa, we are trying to penetrate the market. We are just about to sign our contract in Tanzania to install over 38 mammography in the country. In Kenya, you can see our equipment in Aga Khan, and we have our BMD in Nairobi Hospital. We are still talking with several other customers to ensure that this technology is made available in the country. We are an AI-driven company, and AI essentially is not to replace you as doctors, but to enable you, to enable diagnosis and to make your work much more easier and interesting. So today, we are in the gynecological space, and we are providing the gynecology solutions. And in the gynecological solutions, the 2 products that I want to talk about today is the NovaSure and MyoSure. So, like what Dr. Kigondo has presented earlier about thermal ablation and also uterine hysterectomy, the removal of fibroids. So the MyoSure is the device that you use, which is a minimum invasive device that you can use for gynecology, help gynecology to resect and remove tissues, which include the submucous myelomas and endometrial polyps. However, there are some contraindications that when you're using this device, every device has its own advantage and disadvantage, but however, it's true to be cautious that some of these, the MyoSure cannot be used for in pregnant women, and however, it can also exhibit some pelvic infection and has cervical, it cannot be used for patients who are exhibiting pelvic infection and patients who have cervical malignancies, and also patients who have been previously diagnosed with endometrial cancer. So who can you use the product to treat? A childbearing age, the premenopausal and menopausal women, the product, you are allowed to utilize this particular product. So these are some of the types of pathologies I don't want to talk about because you know them very well, but you can see there, you can see type 0, you can see type 1 and type 2, and you can see the large polyps, you can see the small fibroids and large fibroids. Again, these are some of the photos of some of the things that you can use the product to treat and to remove some of these things. I would like to go directly into the product so that I can show you the product, how it works. So this is the product, and it's for single use, and it comes, it's sterile with a cutting edge efficiency that shows multaneous rotation and reciprocation of the blade. The one blade is designed for all tissues and comes with a grade of stainless steel testing for removal of dense fibroids. You will see in my next slide, once I talk about the controller, the different types of blade and the different sizes and how you can use them. So this is the controller that you can use alongside with the blade, and to make your work easier, you can see it has a foot pedal, it has got a cutting timer, and you can see that it's easy of use. It doesn't require much training. Once we have our product cleared, we will have another training session, probably at the Nairobi Hospital Anderson, where you will have access to some of these products and see how you can be utilizing them, just to make your work easier. We are here to make your job interesting and much more easier. But however, you have to spend some money, little money. And I know doctors are very rich people. So you can see that the three options of blade, we have the light, which is 10 millimeter, less than 1 millimeter reach, and we have the extra large. So these ones, you can use them for different procedures. This material, I have them with me, and I'm giving them for free. This is the only product that I'm allowed to give you for free. When the equipment come, I will have some equipment for training, and then thereafter we will discuss on how you're going to purchase them on friendly terms. So this is So this is the MyoSure, the manual device. You can see it has got the integrated vacuum. It has a clear tissue trap area. You can see the blade. The blade is able to rotate 360 degrees to increase efficiency and enable you to be able to perform the surgical procedure. And you're able to visualize have continuous visualization, because you can see that there's an aperture there, and it has been designed for easy of use. These are some of the heteroscopy designs. You can see the sheath that you use together with the device. It comes in different sizes. But however, in the next slide, you will see the fluid management system, which is used alongside with the device. I think of all the products, this is the most expensive system that you need. And it's not disposable. It's not for single use. So because this material is provided and it's printed, you will be able to read through this particular system. And again, you will have a chance to use it during the times when we will be doing the training once we have our product in country. So these are some of the design features of this particular product. You see the bag where you hang your fluid. It has a dual peristaltic pump. And of course, the necessary calibrations to ensure that the minimum requirement is met in terms of the volume and the pressure that you require. It is a very easy system to use. It doesn't require much training and doesn't require a lot of knowledge in terms of technology. This is the last product I would like to talk about, the NovaSure. This is the product for endometrial ablation. It uses the RFD technology. In my next slide, you'll see the description of the NovaSure and the intended use for uterus in premenopausal women with menorrhea, that is excessive bleeding. or due to benign causes from childbearing once the childbearing age is complete. These are some of the advantages of the product. It has been proven. It has a proven outcome, and you can see that the proven outcome in terms of the low reinvention rate of 2 to 8%, and high amenorrhea rates, and then the patient satisfaction stands at 93%. And from the technology side, this is a very advanced technology, and this technology is only provided by Hologic. It's being used worldwide. It's a safe of use, and we want to have it in Africa. Dr. Were informed me that he heard about this particular product when he was in Germany. It was being used, but however, at that particular time, he said that it was very expensive. Some of these good products and some of these multinational companies, once some of these products are rolled out, because of the cost that is involved in making some of these products, the money has to be recovered first from the countries that have money, because they have got very good reimbursement rates. And thereafter, we normally come up with a strategy for market penetration and provide what we call a valuable solution for the middle income. Are we low or middle income countries? Wherever. In my pocket, I feel like we are low middle income countries. In the political state, they say that we are middle income countries. Anyway, this is the products, the controller and the NovaSure. You can see that. The product is designed that it can be able to fit in the uterus, because when you are using it, it gets, and it's open up when it is already inside. It doesn't, you can't use it just like that. And I think some of these things I'm talking about will be much more, make a lot of sense when you see the practical application of the product. We are not far away from there. If you can hang on, we will get there. So the NovaSure technology is a bipolar radio frequency energy, and it's a proactive integrity assessment and unique moisture transport system, and has a scientific proven endpoint. So this is the product you can see from here. I wish I had time to show you a quick video, but it is okay. I'll be able to share with some of you because you will give me your contacts, and that is how it works. You can see from that. And by the way, the endpoint is made of gold, so don't try to reuse it and start making ornaments with it. And yeah, I don't want to repeat anything so that I can save time. That is how it works. Gets inside, opens up, you push. Very easy and very simple. And this is the controller. It has a touch screen, an ambulation timer, and a universal compatibility with all the procedural instructions and volume control alarms. Lastly, this is now the device that you will use with all the calibrations and marking with the cervical seal. Very nice handle, and it's very easy to use. Little energy is applied when you're utilizing it. And I think that comes to the end of my presentation. Thank you very much for this wonderful time and moment. I wish you all the best in your entire journey to have this particular symposium. And I appreciate a lot for inviting me and to be here with you. Should you have any question, then you're free to ask me. And I will be seated outside. Please come and visit me. I bought a visitor's book in the morning. I'll be excited to have all the pages filled. Yes. Simon.
As I've said, my name is Dr. Nyongesa, and this question maybe goes to Gondu, and maybe you might answer also. Dr. Gondu, abnormal uterine bleeding has a cause, and through your short presentation, I didn't see you specifically talk about what are some of those very specific conditions that you'll do endometrial ablation? Because when you look at the applicability, there is so many contraindications of endometrial ablation. So I would like to know what are some of those very specific conditions you will do this endometrial ablation.
I actually thought about that, and or generally, as you have seen palm coin, if you have a diagnosis, you treat the diagnosis. Anything that causes your problem, and your problem is abnormal heavy bleeding. But there are those ones where you have eliminated all causes. You have no cause known, and they want to retain their uterus, let's say. So what we are saying is that it's an option that you need to have available on the table. So endometrial ablation, what we are saying is that the lady, for instance, who wants to retain her uterus and has maybe side effects of medication and nothing is working, so to speak, then endometrial ablation can be given as an option, especially those who are almost past childbearing age, that perimenopausal time where you have bleeding and you don't want to be on medication. And that for me is the technique. Is it available as an option for that? Yes, Mugo does office hysteroscopy, so.
Actually, I don't, but I intend to. That's why it's a very interesting presentation, Mr. Mghanga, businessman. Thank you. The reason why the uptake is low for ablation, I think traditionally we've been doing through resectoscope. If I'm not wrong, Dr. Where will confirm which one he used. So that's technically it's very difficult, and it's prone to complications, especially perforation. Yours is quite revolutionary. I mean, the way, but you did it so fast. As much as we're going to meet you outside, maybe you would have appraised us, like how much depth is burning. Actually, I've never seen it. And even how long does the procedure take and the complications. I would be interested in that because it's looking very, very applicable. Of course, cost, we'll talk about that.
Yes, good. That is a very good question. I have a lot of literature with me. The reason why I was moving very fast is because of the interest of time, and I also want to create some interest so that you can come and pick some of the material that we have so that you can read. And if you have, and also for the extension and continuity of friendship, it's good to leave a vacuum in a presentation so that you can come and approach me and I don't. But however, I have a lot of information that is very helpful. I'm very friendly, by the way. And I've been working with doctors for the last 7 years. And there are a lot of things which we'll discuss. And therefore, you'll have the information that you need. But however, thank you very much for that great interest on the product. Yeah. Can we shake hands, fam? Absolutely.
So I thank you very much for bringing this new idea about endometrial ablation in our setups. Now, NovaSure. I first came across it some years back, almost 10 years ago, and it was mesmerizing when I saw it out there, actually in Germany for that matter. Now, the generator and the actual device itself is quite expensive. And I don't know whether our low resource settings will be able to afford that kind of treatment. However, that notwithstanding, technology comes at a cost. But what do we do at grassroots levels when we have abnormal uterine bleeding and you have a patient who cannot afford the new technology? Now, what I have done or what I've been doing is In a situation where a patient can afford hysteroscopy, we actually borrow the rollable diathem from the urologist and actually use it to ablate the endometrium. And that works pretty well because it's time consuming, you need theater and all that, unlike what you do with NovaSure. The other one would be the use of the simple Foley's catheter. Very simple Foley's catheter. If somebody is bleeding heavily and they're non-responsive to medication, then you can put a Foley's catheter, the largest size possible, probably French 24, and pump in some normal saline, maybe about 20 mL, and leave it there for a while. But you can also use the same Foley's catheter to do ablation using hot normal saline. But you have to watch out. You have to make sure that you have good quality Foley's catheter that will withstand that heat of hot normal saline, and leave it there for about 3 minutes or so. Do it for about 3 or 4 times. And that will actually be able to ablate the endometrium and assist these ladies. The only problem is you get recurrences, okay? The endometrium may actually regenerate again, and they end up with bleeding after some time. So NovaSure, yes, you're sure it will work and work once and for all with finality. But if I come across gold, why not sell the gold and make the money?
Very nice. I mean, thank you for that, your comments. I want to talk about something that is related to the costs. The cost of doing a procedure in the theater, it's number one, very expensive compared to the price of NovaSure. Number two, it's costly in terms of the time. And number three, it leaves the patient traumatized if you remove her uterus. Everybody wants to keep their body parts as they are until the final day when the Christ will call us and we will respond if indeed that day will happen. Another thing that I want to address is related to the time of the procedure and where you can do this procedure with NovaSure. The procedure takes 15 minutes, by the way, and this procedure can be done in your clinic. Right? You don't need a theater to do it. If you take a patient to the theater, what doctors don't tell you is that you're going to pay for everything from the entry to the time that they will make you sleep until the end. The gynecologist will take a certain amount of money. The anesthesiologist normally takes close to about 100,000, depending on how popular it is. The cost of this, if it costs like $1,000, you know, if the shilling was very stable, it could be 100,000. Right now, it's 128,000.
Okay, asante.
So I started selling, but I will sell outside here. All right, thank you.
Thank you, Hudson and Dr. Kigondu. Please feel free to, as Hudson has said, they went outside there. Kindly during the tea break, just interact with them. And as he said, he's pocket friendly for those who wish to purchase anything.